The science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. This is public health. And it's appropriate for the times to mention that public health is rooted in social justice because everyone has the right to achieve good health. 20% of what it takes to achieve good health comes from the transaction of healthcare. The other 80% that helps individuals and communities thrive requires the placement of and access to social and structural determinants like income and the ability to earn a livable wage, education, access to food that's safe, affordable, and nutritious, community safety, and the access of places through transportation, and certainly outdoor spaces. We need 100% commitment to help everyone achieve their best health. My name is Surili Patel, and I work to champion diversity and advance health equity and climate justice while promoting public health solutions. This is why I am proud to serve as a member of the Physicians for Social Responsibility's Board of Directors. PSR staff and members from across the country have shown me their passion and commitment to protect the health of all through climate mitigation as well as adaptation. PSR continues to provide a breadth of vision, a multifaceted action plan, and an effective engagement of health professionals to take actions that create real change in the world. I have seen nurses, physicians, health therapists, academics, researchers, public health workers, and many, many more from across the country all get involved to lend a voice to the climate and health crisis. Now, more than ever, individuals, as a collective, as state chapters and national, we need to move as quickly and broadly as possible in all sectors of society and the economy. PSR National also focuses on education and action for policy change to promote sweeping society-wide change. PSR's national office provides our chapters, our health professional members, and our allies with valuable educational resources on the issues we address. For instance, the Climate Ambassadors Program mobilizes and assists health professionals in writing and placing letters to the editor and op-ed articles that address climate change, energy, and health, as well as they engage local chapters to expand and demand for clean, safe, and healthy renewable energy. There is also a tremendous amount of leadership on climate and health issues at the chapter level. For instance, Oregon PSR helped the city of Portland create the first ever Municipal Climate Justice Fund. Under this voter-approved initiative, led by communities of colors, large corporations contribute 1% of annual gross revenue to locally managed fund to support local clean energy, energy efficiency, and climate justice projects. The fund prioritizes grants to projects that serve low-income communities and communities of color, thus supporting those with the greatest need. In Arizona, the PSR chapter created a flagship program for community resilience from climate extremes. They created a guide called the Citizens Guide for Readiness for Climate Extremes in the Desert Southwest, in order to build awareness and create community planning and resilience in the face of extreme climate emergencies, including heat, flooding, and wildfires. Available in English and Spanish, the guide also provides information on how to help reduce and help stop future climate change. And lastly, you may not think Greater Boston PSR is likely to be a leader in the fight against fracked gas, since there's no fracking in Massachusetts. But this chapter has helped raise awareness from the health and medical voices to oppose gas pipelines and compressor stations. And they've championed the replacement of gas heating with highly efficient heat pumps. The urgency needed to address the climate and health crisis is met with unwavering passion and commitment by the PSR family. And this is why I stand with PSR as they reimagine the health of our future.